because once you melt the stitches, you're gonna come back here to repair your office. Episiotomy is not your mate. Hello everyone and welcome back to my channel. It's Nelly's Corner here again. In this video, I'm simply going to talk about how you can recover very fast from your episiotomy. If you don't know what episiotomy is, just simply means the cut that is being given to you during childbirth, especially when you are pushing out your baby. Yeah, the cut is always done on the VJ. So a lot of women, a lot of mothers dread this cut, but what will happen will happen. See, it doesn't matter the type of exercise or the perineal massage you do. If you're gonna have the cut, you're gonna have the cut. This is not to put fear in you, but this is to tell you that it is something you can overcome within the space of 4 weeks. Because within the space of 2 weeks, the thread will be absorbed, and at 4 weeks, the wound should be healed properly. Yes, it is a wound, okay? So if you don't take these tips I'm going to give you out, these tips I'm dishing out free of charge. If you don't take them seriously, you might get that wound infected, or you might get that stitch loosen up, which might take you back to the hospital for a restitch. This is something we don't even want for our enemy. So the recovery of episiotomy lies in the care tips, okay? So what are those things you're supposed to do to get your episiotomy to heal fast? The first thing is to take your drugs seriously. Any hospital that gives you a cut will give you a healing drug, okay? So don't say I'm not the drug type. No, please be the drug type, okay? Take that drug seriously, because they know what they gave you down there, and they know that this drug will heal you properly. Yeah, and one of the drugs they always give is vitamin C 1000 milligram. Yes, so always take it. You will even take it for up to 1 week. Yeah, depending on their prescription, okay? So always go with your doctor's prescription. The next thing you have to do is what? Please stay hydrated. Drink a lot of water. Drink a lot of water, my people. Drink a lot of water. Let that water be your friend. Drink, because I don't know whether it's anytime a woman gets episiotomy that constipation will come knocking. Hello, longest time no see. You might even be purging during labor, but once they give you that episiotomy, bam, constipation has entered. So stay hydrated. Take enough fruits like short fruits, pineapple, orange. Take a lot of fruits, and also please avoid bread. This one, I learned it the hard way. Avoid bread and tea. Yes, tea will help in the breast milk supply. My sister, see that first 2 weeks, avoid bread. You can binge on your pap. Yes, you can take pap, you can drink tea, just tea. You can also take oatmeal. There are different ways you can take your oatmeal. If you don't like parboiling it, you can leave it overnight in your freezer. Add some what they call it, almonds, milk, dates. I have a video here on overnight oats. I'm going to link it in the description box, or up here if I remember. So try and get hydrated. Eat enough fiber food, okay, so that once the poo comes knocking, you don't get constipated. Another thing you should watch out for is hygiene. Please, top your hygiene should, if your hygiene gain was 100, please top it up by 200, okay? After you must have finished using the toilet, maybe you have pee or you have poo, please use water to wash down there. Use another water that has antiseptic to rinse that side. Get a separate towel and pat dry that VJ. Always leave it dry, okay? The more dry it is, it helps the healing process. Yeah. So the next thing you should do is, sometimes when you're alone, you can just air dry the place, okay? Air dry it, lock up your room and air dry it, because that place also needs to breathe. Another thing that I know, if I say here, people are going to doubt or argue is, please do not do sit baths. Yes, if you must do sit baths, use warm water. I mean, warm water you can comfortably dip your hand in and splash on your body. It should be that warm. Do not sit on hot water, because the stitch that is used for the episiotomy or for the cut is usually absorbable. Shey, that's what they call it, absorbable. Abi absorbent. I don't know. But I know it absorbs on its own. Okay, that stitch absorbs on its own. So when they gave me my cut for my first baby, they didn't give it to me for this third one. Doctor personally told me, please do not do sit bath on a very hot water, so that you don't melt the stitches. Because once you melt the stitches, you're gonna come back here to repair your office. Okay, so I had to allow the thread to absorb fully. That was around 4 weeks, 4 weeks down postpartum, that I started doing sit baths with warm water, because I didn't want story that would touch. I didn't want story that touches the heart. Okay, so the sit bath should be done with warm water, very warm water. You add your salt and you add your disinfectant, okay, and you now sit inside the bowl. The seat baths can be very comforting, I can't lie, okay. The seat baths are very comforting, they suit your body and they suit that area a lot. So the next thing is, I know you want to lose some weight, but exercise should not be your paramount priority for that first 6 weeks of postpartum, okay. That says that first 6 weeks of your postpartum will determine the next 40 years of your life. Because that office, that video that has torn apart, don't take care of it, it might bring infection. If you don't take care of it, it might be loose forever. So that's not what we want. So avoid exercise for that first 6 weeks. I know we want to get in shape, but avoid it till that place heals permanently, till you don't feel pain there. Okay, so avoid exercise, avoid sitting on something that will make you feel hot down there. I know our mothers would say sit on stool, which is good, because sitting on stool will, will prevent queefing. Is it queefing they call it? That unnecessary sound when you are having bedroom dance. Okay, so sitting on stool is good, but if you are feeling so uncomfortable to sit on stool, please let it heal. Once it heals, you can sit on your stool. So to replace sitting on stool, you can do your Kegel exercise. Yeah, Kegel exercise is an exercise you can be doing even as I'm doing this video. I can be doing the Kegel exercise. So Kegel exercise is just like a way, if you are passing out urine and you hold that urine tight, like you want to stop urinating. That is what it feels to do Kegel exercise. I'm not a physiotherapist, okay, but if you Google it, you'll get a better definition. There are some things you have to watch out for, and you know that, hey, there is danger, there is an infection. If if that place becomes too swollen, please go to your hospital. If that place starts bringing out smelling discharge, please to the hospital. If that place becomes extremely painful that you cannot bear to even walk or sit, please to the hospital. And if you notice any loose stitch, mm, 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 please to the hospital. Having said this, I hope you have picked up one or two tips, okay, that will help you recover. And I wish you all the best. I wish you quick recovery. I wish you a happy postpartum period. I'll see you guys in my next video. So for now, bye bye. See you.